of health. Good afternoon, everyone. Good afternoon. Sandra, Solange, it's a great pleasure to be with you here today, especially to address such a special topic, isn't it? First, I would like to ask you to make your initial remarks. I would like to thank for the panel and for the open mind discussion so that we can be here discussing. So thank you, Josier and Rodrigo Villar. Thank you, Fizz, for such a great opportunity to be here for a chat with two great women. Good afternoon, Sandra, Solange. So let's start. Good afternoon, everyone. Claudia, Solange. Thank you, Josier. Thank you, Rodrigo. It's always great to participate. In fact, it's my second year. Very interesting debate talking about innovation. The role of women in transforming health. We have a very important role, and we're going to talk about that today. I'm really delighted to be here with you. Thank you. Thank you very much. Echoing Claudia and Sandra. It's great to see you, Claudia. We haven't been in contact for a while now, right? So thank you very much for the invitation. Josier is always a great host, and here a champion in healthcare. Women have a key role in healthcare, and I would like really to greet all fantastic professionals, women professionals who work with love, always very candidly and with the purpose of adding value to the health of population. Thank you very much, and kudos to all of us. Claudia, your microphone is off. I would like to introduce the two of you, even though it's not necessary. Sandra Costa is co-founder and chairwoman of Sabin Medicina Diagnóstica, and Solange Beatriz Mendes is the director of consumption and relationship of CNseg. They have these positions, but regardless, they are leaders in health and inspiration to many of us. And this is why I would like to start by just warming up the discussion with what we hear from the Congress, from the Senate, and recently analyzing the American elections and access of the population and the number of patients that got sick during the pandemic. The news seemed to be catastrophic in a moment when Brazil needs some optimism. Regardless of the world scenario as we see it, we also have a very peculiar scenario in Brazil. The population has been claiming for more access to health, which is the basis for economy to have a ramp up, because healthy people can be better employed and work better. In view of these very bad situations to some citizens, I would like to hear from you how you see health in Brazil 2020 and how the future will be, how our next years will be between 21 to 24. Let me ask Sandra to go first, and then Solange, and then I have some questions to both of you. Sandra? Sandra, your microphone is muted. So, what you've just described, Claudia, is a fact. But healthcare in Brazil has a number of challenges to face. Population aging, something that we started talking about 5 years ago, and people are living longer and will need to age well with quality of life, not overwhelming our system. And this is why a fully integrated system is going to be essential. Technology also plays a key role. During the pandemic, we've seen how marked it was. We started using more telemedicine, granting access to more people. And this is really something which is not going to change any longer. Brazil is a large country and with huge diversity. In healthcare, we will inevitably need investments in preventive medicine, expanding primary care, as well as personalized medicine. And this is exactly the areas from which we are going to get solutions to have more tailor-made care to all patients. Not only new techniques and treatment options, but monitoring patients closely throughout their whole health journey. It's also important to strengthen public-private partnership to have a system fully integrated with patient-centered care and with more complete information, because this is something absolutely essential. I think the pandemic is leaving a legacy behind, which is the importance of investing in education, science, research. We will only have a better system and a stronger system if we have more and more investment in these areas.
It's great to see you because we hardly get to see each other, Solange. It's great to meet you again. We feel like we would like to be together. We have some protocols on sessions, stay in the center, do this, do that. But what we would really like to do would be to hug each other, to be truly together, because we think about many people would guess that competition drives us apart. It doesn't, because women are more intelligent than that. We have an intelligence that is above our ego. Solange, I would like you to tell us a little bit about this vision. What is the vision of what we are living today? And Sandra has mentioned a few points, and I made a note for us to go further in detail. How do you see detail? You were in charge of the National Federation of Health Insurance Companies and the access that everybody asks for. And in a Brazil that needs to take off. How do you see that? Well, I think that Sandra went from A to Z. She covered everything. And there is a world for discussions and work that we have ahead of us. Undoubtedly, and for sure, the COVID has affected all industries, and I think that the healthcare industry was the most affected. We never talked so much about care, safety of professions, prevention and care, risk reduction, or reducing unnecessary risks. But these themes have always been present in our agenda of us who deal with health. But the good thing is that now they are part of the everybody's agenda. It's a shame that the government is not paying the necessary attention and planning to these actions. And for the first time, what we saw was that SUS was not the target of criticism. And this was something good. Although I have always been on a supplemental health and even though my origin back in the government, I am an advocate. I defend SUS. I like it. We need to value it. But private participation was something welcome. It's been recognized as something important. And as you said, how is recovery going to be? The whole discussion of access and what about funding and resources. And if we look back, we started with individual customers, now we went to the corporate universe that are the main entrants in the supplemental health. But in the past, we had the crisis with inflation and everything and all the difficulties that we had. This led to Law 9656. And you know that I was part of the drafting of that bill. I was in the Ministry of Finance. And then I was part in the first management of the National Supplemental Health Agency. And there were two women, myself and Maristela. I was on behalf of insurance companies, and Maristela Gregori from the end of inspection. And without further ado, because we don't have very long, and I would like to pay a tribute to Marta Oliveira, who was also a director of our agency, and she gave a huge contribution to women's health. So I would like to praise Marta. I was very proud to work with her in the past, and then to see her as a director, and she does exceptional work and what everything and her contribution to women in regulating the agency. And the act incorporated comprehensive and ended with inequalities. I think it was positive. The regulation was based on two: financial, economic, and care related. And then the objective then was we tried to combine to assure care and with the regulation of solvency of the companies, considering having a market with good laws and with feasibility, favoring growth, and thereby providing more access to the population and more quality. Now, have we reached that? That's the point. I would say we are not there yet. So in reality, we need to be brave to discuss the change in the law. And why do we need to be brave? Because those are important points in the regulation, points that we will all need to give something up. Businessmen, consumers, service providers. And when we sit down at the table to have this discussion, the conversation is very difficult, and it has been very difficult. But I am hopeful. So I think that we are there to change it. The challenges are always the same, at least most of them. As Sandra said, and we have very high medical inflation. In the world, it's 40%. In Brazil, it's about 300%, well above any other consumer price index. There's aging, epidemiological transition, and now we have the virus. Uh, so the imbalance of income, the technological advancement, which has always been challenging in terms of costs, but which now has gained some space. Why? Because adopting those, they facilitate access to health. And this way to go, as Sandra said, there's no going back. So other industries such as entertainment and the financial industry already use it widely. And telemedicine is here to stay. During the pandemic, it arrived with the pandemic, but it is consolidating. And then medical records are finally being disseminated. Diagnostic services incorporate the novelties in wide scale. And Claudia knows more than me about that and can talk more about that. Health management is also evolving at large steps, favoring decision-making, facilitating processes, avoiding waste, frauds, and rationalizing. And as to the old issue of cost control, this will effectively need to resort to principles that are old. Focus on prevention, as Sandra said, and being based on good practices of health promotion, as it's been said, and everything based on transparent indicators. The population demands that, everybody demands that, metrics that are in transparency for everyone so that we can all together decide what is best. So in the next few years, and I hope the crisis is leaving a positive legacy, our industry will be using technological resources, also focusing on promotion and prevention, and in basic care is here to stay, or primary care. Both the public and private industries will be focusing on more quality and access to the population. So we need to be brave to do that. As to strengthening SUS, well, you can take that for granted. We don't need even to say that. That's something that we assume. But we need to be brave enough to change what needs to be changed. Thank you very much, Solange. Now I would like to ask, and I'm going to ask a few individual questions so that we can be fast and address. So, Sandra, I have talked about inspiration and the woman you are, and you are as an entrepreneur and a first mover in an industry and in a location that no one thought would be so important to Brazil. And you are an entrepreneur in health. I would like you to tell two women and two men too who are watching us 3 characteristics that you consider fundamental and priority. Of course, we could mention many. Of course, I would like to think the top 3 in 2 minutes to talk about them for a woman who is starting her career or that would like to inspire. Use yourself as an inspiration for the first step to start a career, to look at your career as another opportunity. And having conditions of being an entrepreneur, wants to be an executive officer, a technician in her area. Which are the 3 features that you say, well, these are the main ones I need to carry with me and I mustn't forget them? Well, so the first one, I think that the first step is to identify if you have an entrepreneurship. So there are some features that, in my opinion, are very helpful. I think that number one when we talked about is courage. It's the courage to face the unknown, and it's also important not to be risk aversive, and then resilience. So resilience, I think that being an entrepreneur in Brazil has many, many challenges and limitations, but with the perspective that it is possible. We know it is possible, and we have many victories. So we are witnesses of that. And lastly, self-confidence. It is self-confidence and energy to make your dreams come true. Believing in your dreams inspires many people to work with you for the same purpose. And another thing too, Claudia, that I see that today things are so much easier, and the new generations of entrepreneurs and leaders have access to many systems and ecosystems that support and invest on development of entrepreneurs. And we didn't have that way back when. So there are subsidies from companies, self-funded. So all of this helps a lot. And also access to supply to good practices, management models. And all of this helps a lot to structure the model, the business plan. And we can see Sebrae, and with incubators and accelerators for startups. I speak as a businesswoman as part of Sabin group. We always support and investing in many different projects and businesses that cause an impact. And most importantly, for new entrepreneurs, I think that one needs to understand that today, adaptation capacity is something very important, because oftentimes we need to make minor adjustments in business and in life, and it is fundamental for you to be able to use the opportunities within the context. And another important point, and it is important for us to emphasize, is the issue of constant learning. I think that we need to learn every day. So this thing of wanting to get to knowledge, it's important to be in constant development, studying, and always seeking new skills and self-knowledge. Oh, great, a lot to talk. It's a shame we don't have very long. We could spend a long time here. Thank you, Sandra. Now I am going to ask Solange. Solange, Sandra mentioned the attributes, the features. And now I would like you to talk about action. We know that 70 to 80% of women are on the basis of the health pyramid. And this means that women that work on the front end, on the front line, in factories, service providers, in hospitals, clinics, laboratories, health plans, in billing, and in many areas, and so on and so forth. And we do not see, it's not less than 10%, it's less than 10%. We see 3 to 4% women in leadership. And not just CEOs, I'm talking about department managers, brand managers, company managers. So we don't see this in healthcare. It's a trend, thank God, and you mentioned Marsha, and there are other people in companies in many different areas in the health industry. But if we look into the future, in spite of this bad cultural heritage, what can we do to effectively make it faster, in addition to the support that she mentioned, to transform people and women in leaders, to make them leaders that are going to take Brazil into the future in a better and faster way. And here, it's not that we don't, not looking down on men, because we need to have a combination. What can we do not to have such an intense imbalance? What could we do? I think that this theme of women being on the basis on the pyramid is not just in healthcare, and reference is even a reference because there is a majority of women. So the basis permeates all our industries. Insurance is like that too. So there's a vast majority of women, but not in management positions or leadership positions. I believe, Claudia, we need to provide personal and professional development along the lines of what Sandra said. You need to grow, to improve, you need to strengthen yourself in order to be able to see and believe and move forward. Now, I think that above anything, this engagement of women needs to be better organized with an effective purpose of facing difficulties, and they're always there. Looking into growth, recognition of women, and women need to look up to other women, and they need to see other women being brave, confident. I don't want to say something, well, men and women, but today, in the current stage of society in the world, we need women to become stronger, to empower and get together. And I believe that women's leadership is different from men leadership. We need to keep our features and our differences to grow. So we need to be brave enough to show ourselves, to believe in what you think. And we who are leaders need to be brave to make things different. Not to try and find male standards. I think that we do need to look after outcomes, results, success, and efficiency. But according to our own standards, women have been accomplishing a lot and gaining more and more space in the market. And with more and more education, they are more involved with entrepreneurship. And that women have stood out with that regard. We are holding higher and higher positions. It's a long way. And there is an overload because of domestic chores and domestic violence and gender-based violence and leadership. It's not easy. It's not an easy position. It calls for time, dedication, in professional investment, and a domestic way, and it requires a lot. So I know how to divide time. I had a family. My children were very understanding, but it's difficult. It's hard. And so we need to have a lot of determination. And empowerment is to see yourself as fully capable of growing professionally and of leading in an effective way, leading a business, meaning a word that Sandra said, and I am emphasizing it, self-confidence. The first step is for women to see themselves as capable. Being perceived by others is the next step, but first of all, they need to see themselves as capable. Now, we need support, and support must come especially from other women in an organized by groups, associations. But I think that we should be more united. And many times in a work environment, having a female, a woman boss is worse than a man boss. So we need to understand that we need to be united together. In the insurance market, we have AMIS, the Association of Women in Insurance Market. We work with that direction. It's a way that the market has found that our insurance brokers that are very active at CNseg, we have our own work group to address and to talk about diversity and inclusion, and women are the first ones, and this is decisive. So there are many obstacles, and the main one is the sexist culture or a male culture. But it's something structural, and for this reason we cannot deal in a very light way with that. This is structural culture, and opportunities are given to those who are similar to you. And today, who's in power? Well, men prevail. No, the choices are only equal. It's not that you don't want other women. They look at other men and they relate to them. They identify with them. So, also companies are being asked about that, and the seed has been planted. I think that all major companies have many actions. And I think that objective actions by companies is to have goals to reduce the discrepancy in the number of leadership positions held by men and women, to create instances for the implementation of those actions, because it's not enough to talk and talk. Well, we need to have effective actions. There must be committees that will be responsible for those actions to be part of the plan of the company. And at the same time, I don't know whether in parallel, but likewise, I think that we need to encourage senior leadership actions, engagement. Senior leadership needs to be engaged. If they are not involved, all efforts and everything are in vain. And the participation of men in the debates and initiatives. They need to come together with us. Whenever I have conferences at CNseg that are more addressing this theme, I say, I don't want just women in the audience. Men can come too. Just women, it doesn't work. So we need to demystify labels. Oh, you're good looking, or because you need to look after that. No, impossible. I think that we need to be on an equal basis. Women need to know their position and need to know to be able to see the frailties. And lastly, I'm going to say something that I always say. I think that we need to go after values. And in the case of a leader, what are values? Being humble, discipline, respect, recognition, concentration, good communication, not being narcissistic, a low profile personality, decision-making capacity, being accountability, technical skills, emotional intelligence, attention to whatever is around, creativity, and honesty, moral, both moral and intellectual. Above all, it's not enough to go after those values. We need to demonstrate and really show that they are firmly on the pursuit of reaching that. And this is my message to us women.
It's a message to women and to men. I know we don't have much time. We just have 2 minutes. We could be on and on talking about it. We'd better give a suggestion to Socia. Next time we want to be longer here. And it's worth listening to what women have to say. I think it was a very good interaction because we could really talk a little bit about the female world in transforming health. As we don't have much time, I'm going to say one word and 1 minute to each. 15 minutes, 1 minute, seconds, 1 minute, and 1 minute to talk about the word collaboration. I would like the two of you in 1 minute tell us more about collaboration. Collaboration in transforming healthcare. Sandra? Well, this is exactly what we are going through right now. It is what we've been doing the most. Especially women in healthcare, we are the safeguarders of health, of family. We know about the needs related to care, and this is the moment for collaborating, cooperating. Women have a key role to play in this moment of doing things together. Having women being part of a development team, of a leadership program, collaborative projects, innovation projects, this is all very strategic and very important, not only for healthcare, but for all companies. I think this is absolutely key. Thank you very much, Sandra. Solange? You have to control my time, right? I always take longer than expected. The word collaboration is exactly, it goes without saying, participation of all stakeholders. We have really to give away some of our space so that someone else can also contribute and that everyone can share and contribute together. And this is not considering just yourself, but everyone. We all want to succeed and we all can succeed, but we want everyone to win. It's a win-win-win-win situation. And how can women be part of that? Trying to understand what's really important to be achieved and what can be shared and what can be done without. Of course, providing care, protection, results. But we should be sensitive. We should be sensible. We are not going to achieve success unless we lose a little bit. So we always lose to win. And when I talk about reform the law, this is what I mean. The law comes just to regulate healthcare companies, regulating part of HMOs. I don't know whether it should regulate other players or maybe regulate no one and just allow the system to self-coordinate. We know it's not possible, though, because there are huge asymmetries and some regulation is required. But everyone should be involved. We cannot expect just a part of it to do things. We cannot just expect part of it to do something. We cannot just accept one complaint. We cannot simply accept success from one side without the other. And this is for everything, life and our personal lives and families and everything. Well, I would like to thank enormously for the opportunity to be here with these two great women. Let me thank once again FIS and tell you that women, when transforming the world, will bring more content and value. And this is needed in Brazil and in the world. Thank you very much. Have a great afternoon. Thank you. Thank you, everyone. Thank you.